proposal that my Republican colleagues proposed last evening would have dropped 16 million Americans from coverage, increased costs, and in fact thrown our entire health care market into chaos. But this is really a victory of the American people. It was the thousands of Americans all across this land, in Rhode Island and in Arkansas and in Oklahoma and in Oregon, who came out and made it clear that they needed health care, that their families depended upon it, that their ability to compete and contribute to the country depended upon it. And so for them, this is a moment that is important and significant. It was not shocking last night, frankly, when this measure was defeated, because the bill was hastily put together. It was not brought forward in a way in which even Republicans could contribute in significant ways. It's why one of the many reasons Republican governors across the country criticized it. It is an example, I think, of really how not to do health care reform, major legislation. We all, of course, have to be thankful for and commend the courage and the tenacity of John McCain and Susan Collins and Lisa Murkowski. They never forgot that they were representing their people and the people of the United States, and they never bent to extraordinary pressure. It's particularly notable that Senator McCain returned, even though he's facing a grave illness, to do what he thought was in the best interest of his country. No surprise for a true American hero. He's been doing that since he was 17 years old, and I'm delighted that he was there to do it last evening. Now it's not just an issue of opposing something. It's now an issue of coming together, Democrats, Republicans, state leaders, national leaders, doctors, patients, everyone coming together to try to craft improvements to the existing healthcare system. We've made progress with the Affordable Care Act. We've had millions of people covered in this country. We've had a situation where men and women who were without any access to health care now have it. We've done a lot of good things. We can do better things, but that requires cooperation across the aisle, and Sheldon and I stand ready to work across the aisle from state level to federal level to community level to improve our system. And now I think it's up to the President to join this great effort. It would be really unfortunate if the President decided that his response is to undercut the current healthcare system, to try to upset and disrupt the delivery of healthcare to millions of people as a result of this effort, rather than to join with us, work with us, improve the system so that we all, and more importantly, American people, can look forward to much better health care in the days ahead. So that is my hope. Sheldon?
Thank you, Jack. The purely partisan strategy of the Republicans on the health care bill caused their measures to be whittled down and whittled down and whittled down until finally last night we had to face the last remnant of it, which was really just a random torpedo fired at the health insurance system with no goodness in it and with no mechanism for rescue of the millions of Americans who would be thrown into a state of no health insurance as a result of it. So in many ways, we can be very relieved that this measure finally failed, and that we hope it is at this point dead and buried forever. But that does not end our task. We avoided a very significant calamity, but we have work ahead of us. And both Senator Reid and I stand ready to do that work. We welcome doing it in bipartisan fashion. I serve on the HELP committee, and I have a lot of personal confidence in Chairman Lamar Alexander and in our Democrat ranking member, Patty Murray. You may recall that they just did a very significant bipartisan education bill, and at the end of the unanimous vote in favor of that bill in the committee, Chairman Alexander choked up. He was so moved by what had been accomplished in a bipartisan fashion. That is what we need to get back to on health care, and I hope that after this vote we can. Thank you.
Senator, it's, I think, pretty common knowledge that the Republicans now say they're moving on, and yet I think many would agree that the ACA does need improvement. What do you think the prospects are of being able to get together with Republicans and do it in a bipartisan fashion?
Well, I can't really speak to the Finance Committee, but on the HELP Committee, what I anticipate will happen is that there will be a cooling off period of a few days, and then some outreach at a whole variety of member and staff levels, and that an understanding will emerge about what the committee will begin to do to go about the business of improving the quality of care and the cost of care for Americans. And I think there are big bipartisan prospects there. It is not a fool's errand to try, so I'm optimistic at this point.
Is that how the two of you senators saw this always playing out? Was that the GOP was in some ways backed into a corner, they were going to try unilaterally, and then they would come to you, and that it was not going to be bipartisan from the get-go? Or what surprised you about what took place?
Well, I think their plan originally, starting in January, was to do their form of reform exclusively with Republican votes. That's why they chose the process where you didn't require a supermajority. You just required and they thought they had 50 plus votes. And they excluded any kind of collaboration. In fact, they really excluded collaboration even within the Republican caucus. This bill originally was written by 13 male Republican senators privately, without any input. That's not the way to do business, and I think eventually caught up with them. And now, as Sheldon suggests, and as I concur heartily, now it's time for us, and there will be a little bit of cooling off, to sit down and think of practical ways we can improve the healthcare system in the United States. Make sure we provide cost subsidies for premiums for individuals. Make sure that we are fully advertising access to periods for affordable care sign-up. There are other efforts in terms of drug pricing and other things that we can do and should do. And that's the way, I hope the lesson is, we can do things together. It's hard to do it alone.
Given what's been happening with this White House, though, do you expect any cooperation or leadership from the administration?
I don't think we expect it, and I don't think we need it. Senator Reid is one of our leaders on the Appropriations Committee, and he has seen firsthand how on the funding side, the appropriators, with Senator Reid in a very significant leadership position on all of that, have worked with their Republican counterparts in the Senate and with their Republican and Democratic counterparts in the House to craft the funding bill that we are under, and are working towards the next one that's due up in September. All of that has taken place without much cooperation or help from the White House. Congress can do a job on its own in bicameral, bipartisan fashion, and so there's a wide road for us to do it on health care as well.
I think we can pursue that. We'd like to see every component, not just the federal elements, but also there's some great ideas at the state. States across this country have implemented the Affordable Care Act in very ingenious ways, which if we could duplicate would help us and would help citizens across the country. So we've got to get back engaged. But I think the natural reaction is going to be a pause now. And frankly, there's such a tremendous backload of business. Senator McCain and I were very much hoping to not to be here today, but to be in Washington doing the National Defense Bill. But they would not allow that to go forward. We have to do the defense bill. We have to do several other major pieces of legislation. But we can't just let health care go. We've got to on a bipartisan basis, pick it up and move it forward.
And for senators to work in a bipartisan way, would they have to defy the leadership? Is not the president of the Senate obligated to do what the president of the United States wants, which is to undermine the Affordable Care Act as it stands now? Are you guys going to have to work with colleagues without the permission of leadership?
Well, no, I think, as I said initially, I think what really prompted this great debate and ultimate result was that the American people, constituents of all my colleagues, Republicans and Democrats, stood up and said, you know, we need this. You can't raise our rates like this. You can't throw us off coverage. Those concerns are still alive. And I think now, I hope some of our Republican colleagues will feel even more sort of liberated, if you will, to start working together with us with practical solutions. It might require a legislative provision to make sure the mandates are paid, not an executive discretion. We can try to do that. There are several things we can try to do. But I think the message that came through loud and clear from the American people was, you know, fix our health care, don't take it from us.
The test will be how the committee chairmen respond. Orrin Hatch on the Finance Committee and Lamar Alexander on the Help Committee are both very well-regarded senators with long histories of bipartisanship, superb legislative skills, and very good relationships on both sides of the aisle. So, as Jack and I agree, there's probably needs to be a bit of a cooling off period, but I would hope and expect that before too long we will see leadership from the Republican side, as it should be, under regular order through the committee chairman.
Anyone else?
Do either of you is it either of yours understanding that there were threats that came from the administration to any of your Republican colleagues, and I guess for the moment use the term threats, but beyond normal pushing and talking that might go on?
I've seen those reports, but I haven't had a chance to speak to any of my colleagues directly, so I have no way to confirm the reports.
Same here, nothing firsthand beyond the news reports.
Senators, there's a report today that North Korea has fired a missile. And we've seen some reports recently about the dysfunction of the White House between what Scaramucci was telling the New Yorker and the kind of tweets we're seeing out of the president. Do you feel as if the United States government is prepared to deal with international threats at this time?
This is a serious incident by the North Koreans. Apparently the missile was fired into the economic zone of Japan, their territory, and that is a very serious incident. I have been in discussions with the Secretary of Defense on a regular basis. He and his colleagues are taking this very seriously. Almost a daily basis. He is meeting with Secretary Tillerson and others. They understand the severity of this situation. And again, my hope and my expectation is that an issue of this importance to the country and the world would help, cut through some of the atmospheric issues at the White House, and that there be the real attention it deserves.
Why would you expect that from what we've seen?
Because you've got very serious people like Jim Mattis, the Secretary of Defense, because there is an understanding of the danger of North Korea with a system like this. And again, from my conversations with the Secretary, I can tell you he is focused and along with his colleagues on this issue, and he is doing everything he can.
Do you think the apparent dysfunction, though?
Let me add just one point to that, which is that what North Korea will also be looking at is the immensely strong sanctions vote, notwithstanding headwinds against it from the White House that was powerfully bipartisan both in the House and Senate, and that was another expression of Senator Reid's leadership, because he and Senator McCain, as the ranking member and chairman of the Armed Services Committee, had a lot to do with making sure that that process stayed in place and came to the very strong result that it did.
Do you think the apparent dysfunction, though, it maybe is emboldening people like Kim Jong-un and Vladimir Putin in situations like this?
No, I don't think so. Not. I think they have a very deliberate policy they want to pursue. Kim Jong-un has been trying to accelerate their nuclear program, going back before the Trump administration, going back in fact with his father, starting under the George W. Bush administration with an atomic demolition. So this has been picking up speed and technological expertise. That's what's disturbing. I think Putin also has been talking about a new rebalancing of Europe, particularly. That's been going on for years. So this motivation is not to take advantage of, of the perceived disarray. The issue is, and that's why we have to be on guard, is this disarray limit our flexibility, our ability to successfully push back on these efforts. And again, I can speak only from my discussions with the Secretary of Defense. He is very much focused on the North Korean issue particularly.
Proper response.
Well, I think the proper response is a response, frankly, that we're pursuing, but to date has not yet been very fruitful, which is to put diplomatic pressure, economic pressure on North Korea. China is the key lever in that process. They have not, however, been as cooperative as we initially thought. I think we have to also, particularly with this latest incident, involve more of our European and international partners in the effort. I think, frankly, the President did miss an opportunity at the G20 when he didn't make this one of the two major issues that he brought to the international community, the North Korean missiles and also Russian interference in democratic elections. But at this point, we have to pursue every non-military lever we have. We have to exhaust those first. Sanctions on individual Chinese companies, sanctions on international companies that do business with North Korea, trying to cut off their supply of critical materials, a whole host of things. And we have to do that and do that aggressively.
Speaking of non-military, where's Rex Tillerson?
The Secretary is, honestly, I think this week he took a few days off because his last travels took him to the Mideast, to Qatar, and particularly to try to resolve that dispute between the Gulf Coordinating Council and the Qatari government. So he's there, but their efforts, as the Secretary Mattis pointed out, the State Department is much involved in their discussions in terms of trying to bring these non-military tools to bear. But this is a very, very difficult problem in North Korea. It is very, very concerning and very, very difficult.
Back to healthcare. If the President's intent on sabotaging the ACA and having that fail, what's the mechanism that Congress can intervene and prevent that from happening? I mean, aren't the payments isn't the executive branch control of that?
It is difficult to interfere through legislation in the operations of an administrative agency that is already operating within some delegated legislative authority. It takes a lot of doing. It's a lot easier to stop it than it is to get it accomplished. The whole system is designed to give administrators flexibility. And particularly in this space where you're dealing with insurance companies that have to make projections about future risk and what the government might do, then even without actually taking an administrative action, just by the type of tone and the language that Secretary Price uses, they can absolutely sabotage the health insurance marketplace in a number of areas. I think we're probably too robust in Rhode Island for that to happen here, but in a lot of areas it could happen, and conceivably that could wash even into Rhode Island. So this administration needs to make a very significant decision about how grown up they're going to be about trying to make sure that Americans aren't hurt for them to make a political point. And there's not a lot we can do about it other than to call them out, because we are in the minority on both sides, and legislation is a slow response to a much quicker administrative decision-making capability that the administration wields.
I think Senator Whitehouse's point is that one of the great uncertainties now, which is affecting rates, is whether the president will use his discretion to pay the core subsidies in the individual markets. I think after last evening, there's going to be a recalculation of what they have to do with respect to the Affordable Care Act and the medical health care system. I think the notion that they can blame it on President Obama is evaporated. You know, I think they're going to come to recognition is they have to respond to the American people's concerns. And I would hope that he would just, through his authority, continue the cost sharing. Legislatively, we could think about proposing the legislation, even in the appropriation process, try to include it in the appropriations process, and then urge them. And I think on a bipartisan basis, and again, I think after last evening's vote, there might be more willing people to come forward and say, yeah, let's as we work on reform, let's make sure this current system continues to operate as best as it can. And that might be a possibility.
And with any luck, we have a little window for that, because today's vote, last night's vote, no, today's vote,
I'm
today's
sorry.
vote, absolutely.
Yeah, sorry.
Today's vote was a big relief also for the insurance industry and the healthcare industry. The bill was really destructive to the whole concept of health insurance, so there's a little bit of a lift while they can now breathe again that this bill wasn't going to pass. But at some point, they're going to be looking to signals from the administration, and that breather isn't going to last too long.
Let me just one other point too is, one of the key actors in this process were Republican governors like John Kasich of Ohio and Brian Sandoval of Nevada and others. And they're not going to stop talking about how this system has to be, maintained and improved. And so this discussion that's been kicked off is not going to stop with this morning's vote. In fact, it's going to continue. So the administration will be under not only legislative pressure, but pressure from many Republican governors to deliver on the promises of the Affordable Care Act. That'll be helpful too. So we've got a lot of work to do.
At the risk of asking you guys to predict the future, where do you think we'll be on this issue and others, say, a year from now? If we asked you a year from now, where would you like to be? Where do you think we will be?
I would hope we are through committee with good work having been done in both the Health and Finance committees. And if we don't have a good piece of legislation passed, that we've got one on the floor that we're working on. I think there is a lot of pent-up good work that got blockaded by the fixation on this particular bill and nothing else. And so there's lots to do, lots of interest in doing it. And I detected last night when we all left the floor that there was not a lot of rancor and bitterness on the floor, except in maybe a few very, very narrow quadrants. But I think the sense was almost a sense of tenderness and desire to move on and try to come together after this. It was not a bad place to be after the vote. It was kind of surprising that way.
I think, again, Senator Whitehouse is very prescient about what I hope we will see, which is a collaborative effort And again, I had colleagues on the other side come up to me and say, you know, we've just got to work together, and that was encouraging. And I think, too, what's been taken off the table is this 7-year crusade to repeal the Affordable Care Act. I think now expectations are appropriately lowered to making it work much better for the American people. And in that sense, I think it would be a bipartisan effort, and I think we can get some things done. And I think that'll be the demands, as I said, not just of you know, the authors of the Affordable Care Act, but many governors, Republican and Democrats, many mayors, and millions of Americans saying, make this better, don't make it worse.
So besides saying you stand ready to work with your colleagues from across the aisle or go through the committee process and trust that the chairman are going to do the right thing, do you have any sense of maybe putting together a gang of 8 or a gang of 15 or a gang of people that want to sit down and put something together that everybody
Oh, I think that'll come. I think right now this is, you know, there's a time in which you have to kind of relax and recalculate and reorganize. But as Sheldon pointed out, Senator Alexander and Senator Murray, I'm sure next week they're going to be sitting down talking informally about how they can, what they can do, how they can do it. Even in the context of the appropriations bills, there may be some things that can be done by the Appropriations Committee that, you know, small but very important changes or fixes that could be accepted by both sides. But I think at this moment, this is more human dynamics than legislative scholarship. People need to just take a rest and relax for a while. This has been a very grueling process for over weeks and weeks and weeks, coming to a culmination last evening. Now it's a time to just, you know, reset, recalculate. But I'm sure next week the discussions will begin.
It was mentioned that maybe all the women in Congress should get together with the health care bill, and there was something.
I don't think anybody would mind any kind of a good effort, but I think that the best gang in the Senate is a committee of the Senate. And for the Health Committee and the Finance Committee to get to work would be the very best signal.
Yeah.
If they fail, absolutely gangs of 8 or 10 or 12 or whatever will emerge to move forward, because I think there's broad bipartisan sentiment that there is serious work to be done that needs to be done.
And if you use the committee structure in the Senate, you'll have a group of very talented men and women who will contribute significantly to the process. And I think that is the way to go.
Thank you all.
Thanks.
Thank you.